Good afternoon and welcome to the Ending the HIV Epidemic Town Hall Session Part 2. I'm Michael Butler, Director of Ryan White Services Program here at the Marion County Health Department. Today we're coming to you from the 4012 building on the Marion County Health Department campus. We would like to express our appreciation to Continued for their support today with all the technical aspects of our town hall session. Can we start the presentation, please? The Marion County Ending the HIV Epidemic Plan was developed over the course of just about 12 full months. The plan, next slide, do I control the slides or someone else? There we go. The plan was the product of a national initiative that was introduced during the 2019 State of the Union address by the Trump administration. It's a 10-year initiative to reduce new HIV infections to less than 3,000 per year nationally by the year 2030. The efforts in the epidemic began in 2020, and with a few delays as a result of COVID, have gotten off to a slow start, but are expected to really pick up over the course of the next year. The focus of ending the epidemic is initially on 48 counties, and a total of 57 jurisdictions across the United States. These 57 jurisdictions combined provide more than 50% of new HIV diagnoses nationally every year. And Marion County here in Indiana was one of those 48 counties that contributes to that 50% of new diagnoses. The focus of the End the HIV Epidemic strategy nationally is on 4 pillars: diagnose, treat, prevent, and respond. Next slide, please. The Marion County End the Epidemic Plan was a collaborative effort to be created. It was led by the Health Foundation of Greater Indianapolis and JGA and Associates. The planning process had a steering committee that was made up of 4 co-chairs, and then a task force of more than 47 individuals representing numerous organizations and agencies within Marion County. And the task force was made up of community leaders, people living with HIV, and other interested stakeholders from across our county. The steering committee met weekly in sort of administrative meetings to ensure that we kept the process moving, and the task force met monthly to provide updates and additional guidance and direction on how we would proceed in developing the plan. Next slide, please. The process of developing the plan was very in-depth. The concepts behind it were to engage experts, both for the task force and to help the task force develop strategies. And the task force members identified potential experts that we would be working with. Through the process of developing the plan and getting the ideas that are included herein, there were focus groups held with priority populations and agency leaders across Marion County. There were one-on-one interviews, surveys, both online and in person. We had a very prolific response to the surveys and to the entire process of developing this plan. Next slide, please. Part of the process included exploration, looking at what is currently working as far as providing services for people living with HIV and preventing new infections in the Marion County area. And what challenges do we have? And then the question of how do we better collaborate and coordinate our efforts? What things should we stop doing? And what is really realistic and achievable? And the big question, how do we fund it? And then, of course, looking at what are our next steps once we've gotten this far. Next slide, please. The four pillars under the national in the HIV epidemic strategy are diagnose, which includes HIV testing initiatives, treat, engaging people in HIV care, retaining them in care, and helping them achieve viral suppression, prevent new infections, which includes access to PrEP, the pre-exposure prophylaxis, and prevention education, and then respond. In the event we should see an emerging cluster of new HIV infections or HIV outbreak, how do we mount a quick response so that we minimize the number of new infections that occur? Next slide, please. In our plan, the community came up with some specific goals under each of the four pillars. Under the diagnose, the strategy is to expand health provider initiated testing and to expand community-based testing, all with the goal of helping people identify their HIV status as early as possible so they can quickly be engaged in care. Under the treat pillar, the goal is that all people living with HIV will be retained in care and benefit from HIV treatment to reach viral suppression. The entire concept of U equals U, or undetectable equals untransmittable, meaning that if you're living with HIV and you have an undetectable viral load, you cannot sexually transmit your virus to another individual. The strategies under that goal include further streamlining linkages to care, retaining and re-engaging people in HIV treatment and care, reducing stigma associated with HIV treatment, STIs, mental health, and addictions. Next slide, please. Under the prevent goal, all people in the priority populations will be offered regular screenings and referrals for sexual health and behavioral health needs, including access to PEP, post-exposure prophylaxis, PrEP, pre-exposure prophylaxis, and other HIV prevention services. The strategies are to promote sexual health and behavioral health, increase access to and provision and use of PrEP, and increase access to syringe access services and harm reduction services. Next slide, please. Under the final pillar of support, organize, and respond, the goal is that community organizations, service providers, and the county and state health departments will collaborate to document and respond to entrenched and emergent health needs and barriers in the HIV response in priority populations, and quickly identify, prevent, and stop HIV outbreaks. Strategies that are believed will be effective under this goal is increased access to supportive services, support community organizing to document health needs and barriers to HIV programming, mobilize community-led responses and work with the Indiana Department of Health and the Marion County Public Health Department to quickly identify and stop HIV outbreaks, and improve data systems and digital technology for improved health surveillance. Next slide, please. I'm sorry, this is the fourth strategy, is workforce and management goal. Between the Indiana Department of Health, Marion County Public Health Department, and all HIV providers, there will be an investment in workforce diversity and competency, and related management and accountability of the HIV workforce and of governmental and non-governmental agencies, organizations, and institutions. This asks for an investment in diversity and linguistic and cultural competency of the HIV workforce, and improved recruitment and retention of community-facing frontline health workers. Also recommends investment in technical competency of medical providers, supportive service providers, and community health workers through trainings, residencies, mentorships, fellowships, and scholarships, and engaging with a diverse range of provider and community networks to foster innovation, coordination, and shared accountability by all agency leaders, service providers, and frontline workers. Next slide, I think that's the end. That is the end. So with these goals in mind in our plan, we began our work this year as a community to end our HIV epidemic and make improvements in the health outcomes of individuals living with HIV. It is now my pleasure to introduce our moderator for today, Ebony Chappell.
Thank you so much, Michael. Thank you to all of my lovely friends and friends on the panel here and colleagues. A little bit about myself, so you guys know who this is talking to you and helping to moderate this panel. My name's Ebony Chappell. By day, I manage programs and communications for Leadership Indianapolis, which is a civic leadership nonprofit. I am also a certified community health worker. I'm an award-winning multimedia journalist, but more importantly, the reason why I'm here today is because I'm a person who cares. I'm honored to moderate this panel and honored to be in a room with people that care as well. You just heard Michael Butler share some insight as to why this plan was created, the work that's being done to help end this epidemic. And today we are going to talk with some of the people who are doing that work right here in our community so that we can see a brighter day. I want to introduce you to our panelists in just a second, but as a matter of housekeeping, if you have questions throughout the conversation, feel free to put them in the chat. They will be relayed to me so that they can be answered throughout the presentation. So be sure to share those. And now to our panelists. Michael Butler, who you just heard from, his pronouns are he, him, his, and he is the director of the Ryan White Services Program at Marion County Health Department. Thank you for being here, Michael.
My pleasure.
We also have with us Angie Martinez. Angie's pronouns are they, them, theirs, and she is the let me get myself together. They are the HIV program manager at Shalom Healthcare Center. Thank you for being here, Angie. Absolutely. Our next panelist is Sylvia Thomas. Sylvia's pronouns are she, her, hers, and she is the Education and Outreach Coordinator of Step Up Incorporated. Thank you for being here, Sylvia.
Thank you for having me.
Absolutely. We also have with us Kimberly Akoff. Kimberly's pronouns are she, her, hers, and she is the Director of Programming at Indiana Youth Group. Hi, Kimberly. Thank you for being here.
Hi, it's my pleasure.
And last but certainly not least, we have with us Bo Dawson. Bo's pronouns are he, him, his, and he is the Director of Outreach and Prevention at Step Up Incorporated. Thank you for being here, Bo.
Thanks for having me.
Absolutely. So thank you all to our panelists for being here. I'm going to start out with kind of a big question that I want everybody to answer. There's a reason why we're all gathered here today. There's a reason why you do what it is that you do for a living. Do you truly believe that we have a shot at ending the HIV epidemic, and why? Angie, since you're sitting right next to me, I'll go ahead and get started with you. Oh, I'm sorry. I'm sorry. I caught you off guard. Yes.
Personally, I think that yes, I think that we can end the epidemic. I think it's going to take a lot of work and a lot of time. Sorry.
And tilt it down a little bit towards you. There you go.
That's better. Sorry. To answer the question again, I think that it is possible. I think that it's going to take a lot of work, a lot of community work. It's going to take all of us, and it's going to take a long time. I don't think it's something, as much as we wish it could be like, bam, we wake up and it'll be done in, a few years or whatnot. I personally think it's going to take a lot more time than that, but I do believe and hope for it to come to an end.
All right. All right.
So you guys didn't hear me.
So we're going to have Angie answer the question again in just a second. I'm going to give you some time, though, because you did just give us a very thorough response. Sorry that you guys in Zoom land couldn't hear it, but, we're working with this technology the best way we can. I'm going to go ahead and go to Bo now. Bo, same question to you. Do you truly believe that we can end the HIV epidemic? And if so, what makes you feel that way? And if not, what makes you feel that way?
Yeah, I feel like it's obtainable. In the past, I would hear goals like this and I would just be like, what are you talking about? Like, we have so many people suffering that don't even know where to get tested, you know? And so, but I think we have the tools, much like Angie communicated. We just have to have community involvement. We are maybe considered the experts or whatever, but community members and community leaders are the experts that will allow us the space and allow us to be culturally appropriate when we go into these communities, I think.
Awesome.
So I don't know if I answered it totally, but I think it'll take a while. But I think it's obtainable. We have the tools, as Michael mentioned, U equals U, prep, all these other things. I think it's just hard work is the missing element. And so we just need to do harder. We need to, people talk about boots on the ground, things of that. We just have to do the work. So.
Yes, we have to do the work. We have to do the work. Kimberly, what about you? What are you thinking in terms of this?
Oh, thank you. I'm very hopeful because of the pandemic leads me to be hopeful that we're living through a pandemic that we came to attack as human beings nationally and on a world stage. And I think we can do the same thing with the HIV virus. We can attack it as strong as this virus is. We are stronger as people. I was around when it, back in the 80s when it was taking a great amount of lives. We as human beings and as a community have fought it to reduce those numbers. And we have a plan. We have a plan as a community. We have a plan as a nation. And I think we have to start talking, those conversations have to come back strongly in our government, both state and federal. And I think they're there. And I think we have to pull communities into those conversations, get navigators into those conversations from the community to put those messages inside the community. We're talking about it constantly, like we're doing this virus.
Absolutely. Sylvia, what are your thoughts on the plausibility of us ending the HIV epidemic?
Yeah, I honestly think it is possible, and as been echoed, a lot of us are doing the work and want to do the work, and we have to do the work. And as much as that is just us as providers, but it's everyone that's community, that it's within yourself and unlearning a lot of the stigma, unlearning a lot of what barriers that you can work towards and destroying to get care, and also reaching out, which can seem really hard, but we're available and we want to be there for you. Speaking directly to community, and because as much as I learn and know so much about stigma and about how it affects, people living with HIV. It also, affects within prevention and people getting tested, and we just need to break that within ourselves as much as we are able to provide that for you. It's a lot of unlearning within oneself what that means.
Yes, absolutely. Very well stated. Angie, coming back to you.
We'll try for the third time.
It's all good. Third time's a charm.
Right. Like I mentioned, and like my, fellow colleagues mentioned, I do believe it's possible. I think it's going to take a lot of time. I think it's going to take a lot of work, and it's going to take all of us. It's going to take the community. It's going to take the providers, and we have to look at it. Hopefully, I hate to say it, like as a domino effect. Like we start maybe in this room, and from this room it goes to the whole building, and from the building it goes to the zip code, the county, the city, the state, the country, the other countries, and Earth Day. It's Earth Day, so the planet, right?
Right.
But it is something that can happen. A lot of work, a lot of us, and a lot of time. It's not overnight, but if we're willing to put the work, possible.
So definitely get you in on this as well. I know you just shared a lovely presentation with us about the work that's been done. Your personal thoughts on this?
My personal thoughts are is that it's very attainable. It's not going to be easy, and it's not going to be quick. There's going to be a lot of hard work, a lot of steep hills to climb. You know, we still have a huge challenge with stigma around HIV. And we have sort of that ostrich syndrome going on with individuals whose heads may be in the sand and feeling that they're not impacted by HIV. So we have to find ways to counteract all of that. But I believe it's very attainable. As Bo has said, we've got the knowledge, we've got the tools. As Angie has said, we've got the spirit to work with our small groups and bigger and bigger. And as Kimberly and Sylvia have said, we've got the wherewithal and the skill sets to do it. We just need to be patient with ourselves, but persistent. And I believe we can do it.
Yes, yes. I think persistence is a key word that really ties a thread through all of the responses that we've heard so far, just persistence. And something else that stuck out to me is the work around bringing the community into the fold. So each and every one of you that are listening, bringing in the voice of the community and the thoughts of the community in doing this work. Right now, we're sitting in this room. We're socially distanced. Everyone has their mask on, and that is because of the COVID-19 pandemic, which has drastically impacted how we do everything, including how we serve people, especially those that are living with HIV and impacted by the virus. I want to open up this question to anybody on the panel that wants to jump in on this, but what has it been like trying to serve and engage with the community during this pandemic? Any highlights, any challenges, anything that you want to share about what this experience has been like? Because although some of us are getting vaccinated, it still seems like we have a long way to go to building back better moving forward.
So I know with IYG, and we provide rapid housing services and training around HIV and AIDS. And with us, it's just overcoming the fear. It's overcoming the fear and just making sure that we're doing the right things. We're following the guidelines to stay safe and teaching guidelines to the young people to stay safe, both while they receive services and when they're out in the streets and at home. So just overcoming those barriers.
Yep. So overcoming those barriers of potentially contracting COVID. Yeah. Any other thoughts on that? Any reflections?
Yeah. I think something very different that I've seen is when I started in the field, I've been in the field for 3 years now. And when I started, it was a lot of, we have these resources, let's go to places and give them to them and go from there. And if people need us, they need us. But ultimately what we've seen because of COVID-19 is how important the matter of getting answers and asking questions. You know, whether it be, do I have COVID, or, you know, asking questions about, am I safe to go here? Is it safe for me to be in this health risk category, or what, all these different things. So a lot of times what I've done in my prevention work now is not just go and be there and provide it, but attack HIV and prevention with the lens of education and asking people through conversation instead of like, oh, here's a condom and here's some lube, you know, and a safer sex kit. I ask people, you know, like, because some people have different languages and culture concepts on how they communicate about sex. So that's like, I'm hearing so many different things and lenses of how people talk about it. And what I've learned is like coming at it with a multicultural lens of just asking people, what kind of sex do you have? Or what is your sexual history like? And just getting them to talk to me, to tell me about it, I'm able to provide more of what they really need than in regards to like what we just have. And so working with my supervisor or working with my team to create more tools and resources for a community that may need this thing rather than just giving them what we have or what we're used to having, because the field is, as much as it's been around a long time, it's still new in a lot of ways, historically speaking. So definitely attacking it more with an education lens, because so many people are asking questions and people want answers. And so just trying to go through that way, I think is the change I've seen because of
Yeah.
COVID.
Yeah, thank you. Yeah, lots of changes, I'm sure, in how you're engaging with people and serving them. Any other thoughts on that?
Yeah, for me, for example, for us, I work at Shalom Healthcare Center, and I've been fortunate to be able to work through a pandemic and be able to be in the trenches. Like COVID, we had to change a lot of what we're doing. Going to giving access to virtual visits to our patients, but then also because we serve underserved populations, not everybody has access to virtual spaces. Not everybody has internet. Not everybody has mobile phones that they have access to, those Zoom meetings or whatnot. So really keeping our clinics open for that, and having to have quarantine spaces because we started doing COVID testing because we're able to do that. So doing COVID testing, doing treatment, doing, now vaccinations, all while still continuing to serve with primary care to our community and doing testing. And then we saw the needs of the community, and having to readapt and work with our community partners. Like we saw within COVID, we saw how community partners and our partnerships had to grow because we couldn't just provide the services to the community members by ourselves. So we did see, it was interesting because you would think that people, were quarantining, people were, distancing, but the services and the need was growing. People were losing their employments. People are still without employment, So all of these services and resources go beyond, just HIV testing, while still HIV testing. When we look at the work that we do, people were losing some of their employments with, the restaurants closing and whatnot. And there were a lot of individuals that turned into sex work. So then like reaching out to them and reaching out to the community partners, Step Up did a great series of sex talks online, and they had individuals reaching out online to get information. So really going beyond what we were doing and re-engage, readapt, and continue to multitask is what I think we learned while going through and continue to go through challenges right now.
Wonderful, wonderful. To put some context, before we move forward, we do have some questions from the audience. And we have a lovely person who is going to introduce themselves first and then share them with you.
Yes, I'm Andrew. I'm with Continued. I really appreciate the questions and the comments that I've seen in the chat so far. We've had some very kind words for our speakers, thanking them for their energy. We just really appreciate you guys today. Our first question is from Al. This is referring to earlier when Michael was speaking, and how much money comes with the plan you outlined? How much has been awarded and to whom? When is the next round of funding to be released? And what community involvement and oversight is there on this funding? And I can repeat that anytime if you need me to.
No, that's okay. Thank you. I think that one's directed for me. The plan itself did not provide any guarantee of funding, but our Congress and the federal government, HHS, Health and Human Services, has awarded Marion County directly $1,750,000 for End the Epidemic initiatives. That's the total amount of funding we've received in the first of 2 years out of our 5-year cooperative agreement with the Health Resources and Services Administration. And in year one, it was $750,000. We did not award any of that funding to community-based organizations because once we knew what we had and we started looking at the environment, we recognized that COVID was going to severely limit our ability to expand any of our funding that we have available for HIV services. So we held that funding in-house, and we'll be receiving that in this grant year as carryover dollars that we will put out into the community. I'm sorry, I don't know the total amount of funding that we're going to make available to the community in this grant year. Out of our $1 million award, I'm sorry, I don't know the exact amount right now. From the Centers for Disease Control and Prevention, the Indiana Department of Health received, I believe, just shy of $3 million for their first year award. And I'm so sorry if that number is high. It might be closer to 2.5 million. And the bulk of that has gone out to community-based organizations to deliver disruptively innovative prevention services in Marion County. And I don't have the list of providers that received that funding in front of me or how much the total funding was. But that was for the first grant year under that particular CDC award. That grant year ends July 31st of this year. At this time, we do not know what year 2 funding will look like from the Centers for Disease Control.
And then a couple of follow-ups to Al's question, just to make sure that it gets answered, all the different parts. The note about how community is involved in disseminating it, are there any community people at the table to help speak to how that's disseminated? One, and then two, is there anyone that Al could follow up with, or whoever else on the call that has those type of questions? Is there a specific office they can follow up with for more information?
Yes, we are currently pulling together our task force that will work with us on implementing the strategic, or not strategic plan, but the Marion County plan to end the HIV epidemic. Looks like this. We hope to have that first task force meeting, I think within the next 4 to 6 weeks. And we will be inviting community members to participate in that process. For more details about the funding that has been awarded so far in the epidemic initiative, you can contact me. My email address is mibutler@marionhealth.org, and it will appear in the chat box for you. And I can provide you information on both the IDOH funding and the Marion County Public Health Department funding.
Thank you, Michael. And then Andrew, do we have any more questions from the audience at this point? No, okay, awesome. Thank you, Al, for your question. And to go along on that point about the community, can we get an understanding for who the priority populations are for this plan? Who are we focused on in terms of outreach? Anybody want to speak to that?
Well, we know that in Marion County, our minority populations are disproportionately impacted by HIV. And when we were first looking at the requirements under the End the HIV Epidemic Initiative and asked by the federal government to identify our priority populations, we identified African-American or Black MSM, men who have sex with men. We identified young MSMs ages 16 to 24. Women ages, I'm probably going to get this age wrong because I can't find the information in the plan real quick, but I believe women are aged 16 to 64. Hispanic or Latinx individuals. And I am missing a couple of our populations. If you give me a couple minutes and I'll find it in here and I'll be able to tell you all of them.
Absolutely. And to that point about MSM, men who have sex with men, another question I want to pose to the group. So the plan and the funding is focused on Marion County, which makes sense based on some of the epidemiology data that Michael shared earlier. But we know that so many people travel, even during COVID, in and out of Indianapolis for various purposes, whether they work here, but they live elsewhere, or they coming into town for some sort of entertainment, as we are still hosting major sporting events and other things of that nature. and they may be going back to places that do not have service organizations similar to the ones represented here. Service organizations that focus on LGBTQ plus populations or service people that are living with HIV. So are there any specific efforts to reach those people that are transient, that are coming in to the city and then leaving and going elsewhere that really need to get this type of information? Go ahead, Bo.
I would just say at Step Up, and this is something that they've done a great job way before I was there, is going into clubs and bathhouses that, you know, may be entertaining or may be a way to relieve stress because you can be around people that are like-minded or see the world the way you see it, or just sexual orientation. And so we try to be in those spaces when they do travel, that we could provide testing services. We could provide them hopefully as close as if they're in Plainfield or something like that on the west side of Indianapolis, we can talk to them about how Shalom offers PrEP. You know, we could talk to them about, you know, just trying to make it fit for them as they're trying to navigate those rural settings. So we try to be in those spaces, and Step Up's effort is going to be to try to be in other spaces that we haven't traditionally been in, and try to provide that, the same services.
Awesome.
And to note on that too, I think a big thing from what I just took from what Bo said is how collaboration amongst agencies is like super key. Knowing what's going on with what we're doing or what we want to do and how we can support each other can be huge in eradicating, you know, and ending the epidemic.
Yeah, absolutely. Sylvia, do you mind sharing an example of what that collaboration has been in the past, or an example of what it can be?
I'm gonna think about it. You know, throughout this process, the ending the epidemic process, it was really great to. I was on a panel in regards to priority populations for the transgender community, and I talked with someone who's transgender who works in the field, and it was nice to just have that conversation. Initially, I think there's a mindset where sometimes people want to be able to do everything themselves or feel like that their agency did it or look good for themselves, but it's not about that at all. And so like for us to talk about it with each other and understand like what our goals are, it was just great. I know that like before COVID, there were conferences where we'd go and listen to presentations, but ultimately something I really wanted to do was to just have more dialogue on like what our goals and plans are for the year, rather than and taking the time to learn together. If we're all in a room, like we should check in and see how we can do better. But in regards to collaboration too, I know one thing that we did with Step Up in the pandemic over the summer was when restrictions for COVID were lifted, or lightly lifted, there was outdoor venues hosting performances and dining, and we partnered with Aspire. They have a PrEP van, where PrEP was being able to given out to folks after being seen by the PrEP provider, after we test them, if they needed that. So having that availability there, and going to a space we never went to before, and that was really cool. Yeah, that's I think a good collaboration, and how agencies, we can still collaborate more in the future. And I know other agencies also provide that. And so like in the future, it's great to then do that again with them as well, and expanding partnerships beyond just the same ones we've always had.
Awesome. Awesome. We have another question from the audience. Take it away, Andrew.
Hey, I'd like to thank everyone again for their comments and questions in the chat. I've been monitoring it, and there's been some really good content in there so far. We had a question from David, who asked, is there a plan to coordinate CBOs to work together? And what he really means by that is is there a formally facilitated collaboration of CBOs by MCPHD for EHE?
MCPHD, Marion County Public Health Department, with some of our CDC funding that came to us from the Indiana Department of Health. We've funded 2 entities that are working with faith-based providers to have the pastors talk about HIV from their pulpit, do some training of their congregation members to be HIV education specialists within their congregation. And we had 2 different organizations that were proposing to work with the faith-based community, and we facilitated a coordination of those 2 organizations so that they weren't duplicating their efforts, but able to utilize their funding in the most maximum way possible, and to reach the greatest number of churches or faith-based organizations that they could with that limited funding that they're receiving. That's the first sort of collaboration that we've helped facilitate happening, and we don't plan on it ending there. I like what former CDC director, Dr. Redfield, said when he was in Indianapolis a couple of years ago, that they're really looking for, the federal government is really looking for something disruptively innovative in the epidemic initiatives, because the things that we have been undertaking up to this point, while they have been effective to a degree and successful, have not helped us end the epidemic. So we need to try a different approach. And encouraging these collaborations is certainly part of that, because we know that funding is limited. We've got a short time to make some true advancements. So we're certainly going to be promoting those types of efforts across the community. I do have the priority populations now that I can run down for you. It's people,
Yes, please.
as identified in our Marion County plan, it's people living with HIV, Black or African Americans, gay men and other MSM, heterosexual women and men, young people aged younger than 25, people born outside the United States, Hispanic or Latinx, people who inject drugs, and people who are transgender. Those are the priority populations.
Thank
There
you.
was another follow-up to that, and I'm sorry, I don't remember what it was.
What did we miss there, Andrew? Because I'm not sure what we missed either.
As far as follow-up, I don't see anything too additional from
Okay.
David on that one. I thought that was a good answer for that topic. Most of what we've seen so far has been some additional comments as far as partnering. Calvin wrote that Step Up and Aspire partner to get together regularly for testing and prep uptake events. And we've had some other comments to that effect. That's all I see for that one so far. We appreciate your answer.
Thank you, Andrew. And Sylvia, go right on ahead.
Yeah. Another thing is, I think from hearing what we've talked about in regards to ending the epidemic and trying to reach these priority populations, is one major thing that I cannot stress enough is for funders or directors or people in HR for these organizations out there, we need to hire our people that are affected by these. So as a trans person, I can name probably like all the trans people in this field on my 10 fingers. And like, I can go to them if I need things or if we want to collaborate. And, but ultimately, like, if we want to reach these populations, you know, I can only do so much in the capacity of my job, let alone helping someone with their work and their field doing this thing. And so, you know, whether it be transgender, whether it be people who are injecting drugs, or the Black community, like, it's a matter of just paying us to do it and also paying us enough to live. Because I mean, something I've seen in the 3 years that I've worked in the field is the turnover rate of folks because of just not being able, like in a prevention field, not being able to meet, you know, needs because of not being maybe paid enough or for what we have or what we're going through and what we need. So I think that's a huge thing, is putting the money into the people who have these access in these communities. So that's a huge thing for me, is seeing more people that I am providing service to be hired on. I don't want to work forever in this field. I want to end the epidemic. And I want people to like ultimately get it over with by having them have jobs now, so we can do that as soon as possible.
You know, you bring up such an excellent point, Sylvia, about making sure that there is more representation, more broader representation for marginalized communities in the field. I know right now we're talking about HIV, and I think that same thing can be said for any service providers. I come out of the health world, and now I'm in a different nonprofit, and it is a constant thing. You think about the fact that a lot of these, when we talk about stigma, you know, where the stigma comes from, and we can get into that as well. You think about the fact that a lot of these marginalized community have what I refer to, and this is, I didn't make this up, I heard this somewhere, but I started using it, but what I refer to as an earned mistrust of systems because of how they've been historically mistreated in the past. So sometimes that can be a barrier to them even reaching out to get help, to get tested, to get linked to care, et cetera, et cetera. And so how representation can help to bridge that gap. So I think you bring up a really excellent point. I want to have other people, if you would like to speak to that point, or maybe talk about what was mentioned earlier, what Michael mentioned about the former CDC director saying that they are looking for disruptively
innovative initiatives.
Disruptively innovative initiatives. I personally love that because I'm all about disruption and innovation as it makes sense to do so. I'm really into that, and I'm interested to hear what, if any, things are being worked on now through this plan to speak to that disruptive innovation. So the priority populations fill up so many different buckets. So many people fall into that buckets. So youth, our seniors, transgender people, people who are using injectable drugs, et cetera, et cetera. What are some of the things being done now to be disruptively innovative, or what could be done better? Go ahead, Bo.
I would just say with some dollars that we received for ending the epidemic, we've come up with a connections project. And that project was basically connecting this, you know, as it talks about respond, you know, and we're worried about outbreaks like Scott County. In order for us to identify those outbreaks quicker to where we could get to those areas, provide services, some of the data collection systems don't talk to each other. And so we'll go and listen to something from the state, or we'll listen to something from the county, and they're kind of telling us different stories. So we took it upon ourselves to go to those entities, to go to Bellflower Clinic, a local STD clinic in Indianapolis, go to Marion County Public Health Department and the state, and just try to get an idea, basically take all the data, HIV incidence and prevalence, and understand where we could go. Push us in the direction of where we could go. And then once we're in those areas and we've identified those 3 to 4 areas, then from there, let's look at those demographics. If the zip code is only the west side of this zip code is probably in need of this, and everyone else is has plenty of money and isn't stigmatized for, I don't know what zip code that would be, but I'm just saying, once we get into that zip code, then it's identifying where do we need to go within that community. And it's doing windshield surveys, setting in the community, then going into businesses, local businesses, and asking, you know, where can we go? Where would you start if you were tasked with, you know, providing services to this community? You know, and then drill down and keep drilling down until we're at a party, you know, we're somewhere where we could provide services to the populations that we're, I don't like to use the word target, but if we're coming down and looking at a hot spot, that seems like where we should go. So But yeah, getting to those priority populations and providing services and not only asking them to come to us for the 9 to 5, but us be there at 3 o'clock in the morning, providing services and taking them to them.
Oh,
as
yeah,
opposed
because
to
they
them-
live more than 9 to 5.
Yeah. I mean, you, in those rural community folks that you said were coming in, they're not going to come in at 9 to 5. They're going to be
No.
working within their communities or close by and coming in at night. So we need to drastically change what's been done in this field, working this 9 to 4:30. We have to in order to, I think, to meet the need.
Absolutely, absolutely. Any other thoughts on that? When you said hotspot, I thought of a hot opportunity. It's hot with opportunity to serve.
And the health departments and even Bellflower have such great epi folks that can pull all of this stuff together, create these hot spots, and we can show this to community, because sometimes community member, especially me being a white, straight, cisgender individual, I go into those communities and I'm trying to offer help. I understand that earned mistrust that you talked about. I understand Tuskegee. I understand all the stuff that OBGYNs have done to Black women in the past. And so I have to take that into account. But in order for me, I care. So,
Yeah.
I mean, regardless of who I am, I care. So I'm going to be there. So I think it's just, we have the tools. Let's do the work. Let's keep grinding. We've had to be at Step Up so innovative. I was thinking, oh, we have to do this now with COVID and everything else. And it was like, I'm going to keep going to my people, my team, asking them to change again. They're just looking at me like, what are you talking about? Sylvia can attest to this.
Yeah.
But we have to, because the community's telling us what they need. If we're not going to listen, then we're just going to stay in the same place.
Yeah, absolutely. Any other thoughts on that?
Yeah, so I want to touch on a couple of things, because it's interesting how like it affects us all in the work we're doing. Like Bo was talking about, doing the work, putting, the effort, looking at the hotspots, looking at, the EPIs that we have, looking at all of that. And what you both mentioned, like, with stigma and historical trauma, right? And like, one of the things that we've been doing, and I've seen some of the our partners do as well, is really engage and look at what historical trauma looks like, because it goes beyond just the earned mistrust, right, in the system in a variety of ways, because it is affecting our priority populations, and there's different varieties of trauma within that, right? So it all adds up, right? So we have all of that. So when we're looking at that and we're looking into engaging to the community we're serving, like we have to prioritize them as a person, not just as this is how we end the epidemic, but how can we see you as a person? So I'm going to serve you as a person, and I'm going to continue to serve the others, so I can serve community as a large, right? So when we approach this way and when we look at it this way, then I think that's where we can develop those disruptive, disruptive, innovative ideas, right?
Yes.
And looking at our whole city and our whole priority populations, like just last year, we started the second campaign in the state, the second campaign in the country for Latinx individuals for PrEP. PrEP has been around for several years, and it wasn't until last year that Mi Gente came around, and it's the second in the country, the first one in Indiana. And when we look at it that way, I'm like, personally, I don't think it's disruptive, innovative. It's something that had to have happened.
Yeah.
So why are we just not doing it now? So we really have to face it, the fact that goes beyond being disruptive, innovative, but looking at all of the lack of access that we've done in the field that we've been doing, and also look at the trauma within the workers that have been doing this, that for so long, they've had to focus on just trying to keep people alive, to go beyond their outreach on how can we help and prevent, right? So now when we look at ending the epidemic and we look at all those pillars and we really look at, all the big picture and say, we're gonna collaborate, we're going to look and work through the different pillars so that we can actually create those disruptive ideas, but also see where we've been lacking access and giving that access to the community. I think that that's very important so that we can continue.
Absolutely, absolutely. Sylvia, did you have something?
Yeah, in
did.
regards to disruptive practices to ending the epidemic, what I do a training through the Health Foundation. I'm funded through the Health Foundation to do a training for providers in regards to make, in the lens of HIV, providing services more competent to the transgender community, or how to better provide services for them. And one of the things I talk about, and that I just now realized, oh, this is a way of disrupting, is when I talk about the label MSM, when we think about the term MSM, because of our field, we all see it very, in our cultures, our own personal lives, and where we come from, we see that very differently. As a transgender woman who, like, I'm just going to speak from personal experience, but if I have, a sexual relationship with a man, and they're going to get tested, they may not identify me as a trans woman. They may identify me as a woman, or maybe even just a man, which is not true. But because of stigma in regards to that, of being a trans person, they're going to ignore that. And so when we think of MSM, a lot of times people may think of just gay or bisexual men, but in reality, it's so much more than that. And
Absolutely.
like, in regards to our health and our bodies, it's all different types of men who aren't just having sex with men. In my field this field that I've been in, anytime I've done a test and I've had a reactive result, none of them have identified as someone who's MSM or LGBTQ+. But they may have also found attracted to a trans person. And so that's like, it's so important for me to like really focus on like, when we're disrupting things. Another thing is when we see words like MSM, knowing that like, it means so many different things for so many people, and it can, trap trans people in there, and when it shouldn't, and not give funding to resources for trans people to get more care or targeted services for them. So that's just another way of disrupting what we're doing to like then make more access for those folks.
Yeah,
that need it.
absolutely. Absolutely. Being more nuanced and having those conversations to get down to the reality of what's going on, and maybe removing some of those assumptions that can be made around behavior, et cetera, for sure. Kimberly, I wanted to get you involved because we haven't heard from you in a little bit. So correct me if I'm wrong, but earlier, did you mention that you've been in the field since the 80s, or did I hear that wrong?
No, I've of course, just been aware of the virus since the 80s.
Got it.
But no, the way we're disrupting is we're making sure that youth have a voice, that, that 16 to 24-year-olds, that they have a voice, that they're able to be educated on HIV and AIDS, that they're okay going to their service providers, their doctors, and talking about that, and that we're making sure that doctors are talking to children who are 16 and up to 24, that those conversations are happening, that their parents, we're talking to parents about talking to their children, educating their children on the subject matter. We're talking to community leaders about bringing that up. We have to start having these conversations and educating people, making people feel comfortable. We have to make them feel uncomfortable so that we can save lives.
Yes.
Because it is uncomfortable to talk to. People feel uncomfortable, adults and service providers, doctors feel uncomfortable talking to a child about, how to protect themselves if they're sexually active. And they think that the only conversations they can have is abstinence. But we have to talk about what does safe sex look like. We have to talk to children about how do they protect themselves. Yes, it's okay to say no, but we have to tell them that it's okay to say no, because there's so many conversations that are out there that don't lend themselves to saying no.
Yeah.
So definitely giving the youth the tools they need, and then giving them access, because a lot of times they go to service providers, and because there's no parent, they can't get that education, they can't have those conversations, and we're hurting youth by doing that, because we're locking them out of true conversations, true ways to help themselves and be preventative. So that's the disruption we're doing.
Yeah. And I love that, being able to provide them with choices, because at one point in time, everybody in this room was a teenager. And to talk about things, and I think we're starting to see a little bit of a change, but talking about things in that abstinence only box is like how many people have been harmed, by that, and by not feeling like there is enough choice and access and like they have any agency over themselves and their bodies. So really, really important. Um, we have this conversation is going so well. We could just talk about this forever, I'm sure, but we just have a little bit of time left. I want to focus in on now how things are moving forward, how things are going to be implemented that you've discussed, and how the public can get involved. So, where do we go from here in terms of the work that you all are doing in the community? Where do we go from here with the plan? And then we'll talk about the rest later. But anybody want to jump in on that as far as like what are the following steps after we leave this room and go on with our work?
I think that, looking at the ending the epidemic and looking at the different pillars that we have, and I think it's really about partnerships and doing the work, right? And when I mean partnerships, it's the people in this room, it's those watching us, it is the community, the other organizations like working in, and like, one of the pillars in the ending the epidemic plan is treatment, and it's, streamlined to linkage to care. And we have organizations like Step Up, the Damien Center, BU, that have Life Care, that have care coordinators. And we have organizations that simply just do testing, right? So doing the testing and linking them to care with those organizations is doing the education, like you have, talking to the youth about HIV and about sex, and linking them with other organizations in primary care and health centers. Some of the, we have some of the goals and how we achieve them in it that talks about, partnering with faith-based organizations. So talking to those pastors, talking to those religious leaderships, talking to the community and holding also the community accountable. So showing up to those bars, showing up to those, the barbershops, the, beauty salons, and really saying, hey, we're here because we know people come here. And it starts maybe with, a bucket of condoms or having those conversations. And then it's testing. And then it's, linking people to treatment or PrEP, or simply talking to them about sex and educating them on how they can have safe sex. So I think that the next step is really to hold ourselves accountable, our organizations accountable, our community accountable, and then continue to work together.
Absolutely. Any other thoughts on that?
I would say integrate talking about getting tested into your normal lexicon of language or phrases. It's just important in regards to not only just being a provider, but if you're a community person, like talking about it with your friends. It may be like we talked about, it may be uncomfortable, but it's necessary. And it's just something so easy that it can help you so much, or help an organization, or just help end the epidemic faster. It's just making it a normal part of conversations and introducing it into like cultures where it may not be accessible to talk about as much, but making it more accessible.
Being cultural aware, I think it's all very important. What you said, Sylvia, like looking at that person that we're looking at for whether it's prevention or testing, or simply, as a community member, that they're going to talk to people, like seeing them and looking at their culture for beyond just who they are. There's so many layers to culture. Culture looks a lot of ways. So really prioritizing that individual, I think that that's very important. And I think also educating providers. I think sometimes we take for granted the fact that as providers, it's part of like our day-to-day basis that sometimes we forget.
Yeah, you can get numb after a while.
So really going back and educate ourselves for it and realize that we have to continue to grow and we have to continue to help each other.
The last thing really quickly on my end is a framework I've invested in myself to do moving forward in my prevention work or whatever work it is in this field, and I've talked about it with my team, is that no matter who I'm talking to, I look at them as a community leader. Even if I don't know them or know if they only have 2 friends, they have access to 2 people who may not know about this or know about the treatment they can get. So talking to everyone as their community leader, giving them the empowerment they have to know that they can make a difference is so important. And that happens through just communicating them, asking them questions, making them feel that they have a way of changing everything. So if I'm at a bar or a bathhouse, even if they have if they're at a bathhouse and they have a towel around them, they're still a community leader. Like, just because they're not dressed up for a panel, you know, they're someone that's important that can reach people that we need to reach. So that's, yeah.
Yeah, absolutely. Bo, go ahead.
I was just going to say, you know, we have this plan that was developed from 880 people, kind of gave us direction. We had, you know, a task force and everything, but any plan that we make, we also, as we learn, we need to be able to deviate and change it and update it. There are blind spots in it. And I think it's just being vulnerable as we get out into the bars, as we get out into the community, and community is telling us this. Yeah, we have 880 people that have had a voice, but, you know, if you look at it, is, you know, of the people that were, only 5% of those individuals were adolescents, you know, that we talked to. So if youth is a focus, I think as we learn more from youth, we need to ensure that gets back to Michael, that gets back to, you know, some of the people. And, hey, we're talking to youth. This is what they're telling us. This is what they need. Yeah, we were adolescents at one time, but things have changed.
Oh, yeah.
And I think, you know, going through a CHI program that I'm going through centered on youth is like, I still see what it was like in 1998 to be 18, or, you know what I mean? It's totally different now. And so it's just still, even if it was, you know, someone like Sylvia, who's very young, it wasn't that long ago, it's still very different. You know what I mean? So it's always kind of keeping that, you know, I talked about a target. This is a target that's always moving, that's always changing, that's always, we're always going to be developing an understanding of these communities. And there's such rich, there's so much knowledge to gain still. But we just get, you know, keep going.
Absolutely, absolutely. Michael, Kimberly, any thoughts on where we go from here in terms of the work that's being done around this ending the HIV epidemic plan?
I just think that we have to continue to forge partnerships. Those partnerships are hugely important, and we have to think outside the box when we're forging those partnerships, not just our normal service providers. And we have to think about now we are thinking about the churches, but we have to think about the bars too, you know, those kind of situations. Just thinking critically outside the box is going to create avenues to have stronger conversations.
Yeah, absolutely.
And I would echo so much of what I've heard said here by our panelists, but thinking outside of the box to the point that we're looking at providers or entities that are out there in our community that traditionally have not been involved in HIV work, and partnering with them, because one of the things that we're challenged to do by the federal government is to help the individuals that we're working with, whether they're people living with HIV or those that are at high risk, help them address all of their needs so that healthcare becomes a priority. And if that means helping them increase their income, helping them find more stable, secure, safe housing, or helping them improve their educational attainment, or a variety of things that we refer to as social determinants of health, let's partner with those entities in the community can help us work with these clients so that they can make those important changes in their lives so that they really can focus on their health and more positive health outcomes. And some of it may make us a little bit uncomfortable, but we need to sort of look at it and say, you know, I do want to work myself out of a job. I don't want there to need to be a Ryan White Services program in our community or in our country. And if that means that we have to do things differently so that we're helping to decrease client reliance on these services and increase their self-sufficiency, those are the things we need to be looking at. Not, how can we protect you from the mean, cruel world out there, but how can we better arm you to protect yourself as you're navigating through that world? And I think some of the things that, again, I echo some of the things that our panelists here today have said. One thing that when Sylvia, I think, was talking about visiting with your medical provider, for those of you out there that are listening to our town hall today, next time you're in your doctor's office, challenge them to give you an HIV test and challenge them to talk to you about sexual health and reproductive health. And even if you're not doing it for yourself, you're helping to educate that provider so that they become comfortable having that conversation with the next patient that they see. And they become comfortable with offering that next patient the HIV test. And that might be the person who unknowingly is living with HIV. So take those opportunities to help make those changes in our system. Because we know some providers are not comfortable having those conversations, or they look at somebody and say, oh, they can't be at risk for HIV. They're married and they're 52 years old and no way. So let's do what we can to make those kind of impacts, as small as they may be, out in the community as we traverse through our lifetime activities or our daily activities.
What a wonderful way to wrap us up. Thank you to each and every one of our panelists. I'm going to say their names again so that you can keep up with them and know about the wonderful things that they are doing. You just heard from Michael Butler, Director of Ryan White Services Program at Marion County Health Department, Angie Martinez, HIV Program Director of Mi Gente at Shalom Healthcare Center, Sylvia Thomas, Education and Outreach Coordinator at Step Up Incorporated, Kimberly Akoff, Director of Programming at Indiana Youth Group, and Bo Dawson, Director of Outreach and Prevention at Step Up Incorporated. It has been an honor to serve as the moderator for this panel. And the one thing that I'll wrap up with, you've heard so much today. We've talked about stepping outside of our comfort zones, becoming comfortable with being uncomfortable, challenging stigma, using our environments in being influential in those spheres that we find ourselves in, understanding that everyone we come into contact with is a community leader in some way, and reaching them can help reach even more people. And just, stepping up and doing what it is that needs to be done to really positively impact what it is that we're living through. We know that due to some amazing advances in science and the great work that's being done by the people that were sitting on this panel and others around the country and around the world, the HIV virus is no longer a death sentence. But the stigma that comes along with it is one of those things that is going to take every one of us to really fight to end. So do your part to do that. Know your status. Have those tough conversations with everybody, because as we heard with the priority populations, this virus is something that impacts every walk of life, no matter what it is that we're talking about. So again, thank you. My name is Ebony Chappelle. It's been a pleasure to serve as your moderator this afternoon, and I will turn it over to Michael Butler for final thoughts and to conclude our program.
Well, I have the privilege of having some final words here today, and I would like to thank you, Ebony Chappelle, for your support and your participation with us today. It's greatly appreciated. Again, showing you all a copy of the Marion County and the HIV epidemic plan. And as Bo said, we really do look at this as being a living document that it's not going to sit on the shelf and stay stagnant for the next 4 years. We're going to work from this, and we're going to change this as we learn more about it. I would like to also express appreciation to Jacoby Hunter Wright with AIDS United. He has been just an incredible asset in helping us plan these town hall meetings. There will be a third one coming up. I don't have a date for that yet, but there will be another. I'd like to thank Dr. Darren Johnson, Executive Director of BU Wellness. Unfortunately, he's experiencing some unwellness this afternoon and can't be with us, so I am a fill-in for him today. But he also was instrumental in getting this session planned today and getting our panelists with us. As Ebony expressed her appreciation to them, I would also like to thank our 4 panelists today. You all have been incredible. Thank you so much for your knowledge and your time and your dedication to this cause. Reiterate my appreciation to Continued for our technical services today. It's been wonderful, and we saw some very favorable comments in the chat box today about that. I hope that we have inspired you to get engaged in ending the epidemic. If you look through the plan, you'll find in there, and I had lost the page number already, somewhere around page, I'm going to say around page 45 or so. It gives a couple tips on how you can be involved in our End the Epidemic initiative if you're a funder, by funding and supporting the organizations that are out there doing the hard work. And when I say funder, I don't just mean the public health department. I'm talking to you, our philanthropies out there in the community. If you're a community person who's looking to get engaged, come talk to us at the health department, talk to one of the service providers and find out what those messages are that you can help get out in the community. As Angie was talking about, let's carry the message into the barbershops, the beauty shops, the corner store, or any of those places where individuals congregate. And let's help everyone become comfortable talking about sexual health, reproductive health, and not just focusing on the STI aspect of that, because it's also very important. Don't be afraid to talk to your children. Have those conversations with them and inform them and help them be prepared to navigate through adult life. And I want to thank you all for joining us today, for your thoughtful questions and comments, and keep in touch with us and learn more about what we're doing as we really get this End the Epidemic initiative underway. Thank you so much for being with us today.
And thank you, Andrew, for being the voice of the audience. I forgot to mention that earlier.
Yes, thank you.